relaxing that shoulder. There you go. A little piece. There it is. Okay.
Okay.
All right. Good job.
I feel like loose, like not that tight.
Not too tight on there? Good. Where do you feel most of the back pain?
The lower back.
So it's right into the center of the lower back.
Yeah.
Okay. And you said there was really no injury that you can remember starting it, correct?
Yes.
Okay. Although you did have an accident last year, but you had the back pain even before. Okay.
Yes.
All right. So it's right into the center. Now I know in terms of we talked a little bit about maybe some things with like work and stuff. I know you said you're kind of pushing and pulling some of the patients, but you never had any pain in regards to when you've done that before, correct?
No.
Like in terms of that wasn't where you feel like you'd started?
No.
Okay. Okay. So a lot of times these things, like I told you before, they happen from, you know, maybe something that maybe a long time ago, right? And looking at your x-rays, it definitely seems like that. And so here, this is where your spine kind of kinks to the left, and then it sends your body this way. So you can have a bit of a curvature going on here. But let's take a look and see what's going on. So is it the standing that causes more pain, or is it
Standing.
standing more? Okay. How long do you feel like you can stand for before you're like, okay, I gotta sit down?
Like this morning, I feel like, you know, when I stand, I need to sit down.
Oh, really?
Yeah.
Okay. So not very long.
10, yeah, not very long, yeah.
Okay, so, okay. Well, let's see what's going on. So I'm going to get you scanned with this guy. And we're going to go from the bottom all the way to the top, and then we're going to work our way down, okay? All right, let's see what's happening here. Yeah, I know we did that nerve scan on you the first time you came into the office. We saw a lot of pressure going into that neck. So it makes sense now looking at your x-rays because of how much stress we're seeing. The interesting thing is that you're not really feeling too much pain in the neck. You said there's tightness?
Tightness, yeah.
Yeah. Right there. Okay. All right, let's see which one we're going to be doing here. So I'm going to push onto the spine. When you feel any pain or soreness, let me know right away, okay? So this one is going to be your L5 right over here. We have 4, 3, 4, 5. Any pain or soreness there?
Discomfort.
Discomfort. Which one would you say was the worst? 5, 4, 5, 4.
Maybe 5.
5, just a little bit more?
Yeah.
Okay. Right there. So as I run my fingers through the spine, I'm looking for where there's some swelling, and so you'll feel like right in here, the tone of this, the skin feels just a little bit more fluidy, so like we call it like a boggy feeling. So when you have inflammation developing in there, you see in the mid-back there's 3 separate areas. The one in the middle is your T7. That's where it kinks to the left and sends you over here. That's this one right there. So we're going to work on that T7 with you as well. Yeah, right there. Okay, so I think we're going to work on your C6. This one, you can tell it's really stuck. Usually what I'm looking for is they should be able to glide forward when I push on that. But this one, as I tilt your head back, it just doesn't move. So that's where it gets stuck there. All right, so just try to relax there. So I always tell people, just try to take your mind somewhere else. Maybe if you like going to the beach, take your mind to the beach. If you like going to the mountains, take your mind to the mountains. Right there's fine. Good. Let it go. Okay, good. And then chin up a little higher. A little baby one. There you go. Good. Relaxing that shoulder. There you go. A little piece. There it is. Okay.
Okay.
All right. Good job. So let's do this. I'm going to have you walk to the corner over there, and you're going to walk on back over this way. All right. Oops. Coming over. So both feet onto the black part. You're going to face the table. And this is the one that your spine, it kinks to the left and sends you over to that side here, okay? Here, 1, 2, 3, 4, 5. T7 right here. Alright, so breathing in for me. All the way out. Let it go. Dropping the shoulders. Relax. We're really tight on there. 1, 2, 3, 4, 5. One more. That's it. Breathing in. All the way out. Good. Almost there. Just try to let your body just sink into the tape. There it is. There you go. And then you're going to have a seat right on over here.
I feel like loose, like not that tight.
Not too tight on there? Good. I can tell you right now, your spine in the mid-back and then the neck, it's really tight, okay? It's interesting because I know in your x-rays, so this is the one that we worked on down here. So again, you can see how that disc, it's a lot thinner. That joint's the one that's really in trouble here, okay? We will need to address your L4 as well, but right now, your L5 is the biggest one. We're trying to get some movement in there, okay? Now we did your T7, that's this one in the mid-back where it kind of kinks over to the left. But then up into your neck, we can tell there's a lot of tension just because when you've lost that curve, things are really tightened up in there. Okay, so we got some movement in there. And then your mid-back, even that one, we got some movement, but I can tell there's still a lot of room for improvement, okay? The lower back, that one was probably the one that moved the most, which is really helpful, especially because you're feeling it right in that area. But with that, so because we got some movement in the joints, you can feel some soreness. That's okay. Just make sure you're using some ice if you have to. Okay. But I always tell people it's almost like when you go to the gym, when you exercise, sometimes you can get soreness after because we did some work on the body. The same thing can happen to your spine when things are shifting around, moving around. Sometimes we can feel some soreness. Okay. So ice is the best thing. Walking, do you do much walking at all?
Yeah, at work, yeah.
At work you do a lot, okay. So walking is the best form of exercise. And so the reason why is because basically we just got some movement into the joints. So it's like we just unlocked the spine. So now things are going to start to shift and move. So as you're walking and moving, that's helpful for the body because it's starting to undo some of that stress. Okay. The last thing is, how's your water intake?
Not much.
Not much, okay.
Yeah.
So if we can get some more water, that will be very helpful because the water is going to help to lubricate the joints, helps to flush out the toxins, so that is going to be something that's helpful as well, okay? Yeah, it's looking a little bit better there. Good. Yeah, that looks much better. Okay, so let's see how that does.
Okay.
So you're all set for today. So
Okay.
remember, like I said, ice, walking, water, and that's all you should be needing to do, okay?
Okay.
All right, you're all set.
Thank you.
All right,
Thank